What if your brain suddenly ran out of fuel? Not tomorrow, not in an hour, but right now. Your hand starts to shake, your heart races. You feel a wave of panic, confusion, and hunger crush over you. You might lash out, stumble, slur your words, or suddenly collapse. To everyone around you, it might look like you are drunk or having a seizure. But the real problem, your blood sugar has plummeted, and your brain is desperately in need of energy. This is hypoglycemia, a potentially life-threatening condition where blood sugar drops too low to sustain normal brain function. It can strike diabetics and non-diabetics alike, and when it does, every second counts. Low blood sugar, or hypoglycemia, occurs when blood sugar levels drop below a critical level, resulting in disruptions in brain function, as the brain can only utilize glucose as a source of energy. It is essential to recognize the symptoms of hypoglycemia quickly, as prolonged episodes can lead to serious consequences. Mild cases of low blood sugar can often be self-treated, but severe hypoglycemia is an emergency that requires immediate assistance from others. Hypoglycemia most commonly affects people with type 1 diabetes, who must carefully manage their carbohydrate intake and insulin doses. An incorrect assessment of insulin dosage can lead to excessive drops in blood sugar. The same thing can also happen if a meal is skipped, if the timing of insulin administration is altered, or if there is a change in the planned duration or intensity of physical activity. People with type 2 diabetes may also experience hypoglycemia, particularly if they are using insulin or medication that stimulate insulin secretion. Additionally, excessive alcohol consumption can lead to low blood sugar, especially when individuals drink for an extended period without eating. Severe hypoglycemia can also occur in individuals with insulin-secreting pancreatic tumors, such as insulinomas. These rare pancreatic tumors cause excessive insulin production, as well as in those with serious illnesses such as malignant diseases, advanced heart and kidney failure, liver disease, and sepsis. The symptoms of hypoglycemia can be dramatic. Initial signs include fast heartbeat, shakiness, irritability, hunger, sweating, headache, and pale skin. As the blood sugar levels plummet further, confusion may arise, leading to inappropriate behavior that may be mistaken for drunkenness, as well as loss of consciousness and coma. In severe cases, convulsions, that is seizures similar to those experienced in epilepsy, may occur. These symptoms typically arise when blood sugar levels drop below 3.9 millimoles per liter. Normal values range from 3.9 to 5.5 millimoles per liter. Individuals who have poorly regulated blood sugar for extended periods may begin to experience hypoglycemia at higher blood sugar levels as they over time become accustomed to constantly elevated blood sugar levels. Conversely, people who frequently experience hypoglycemia may not show symptoms even at lower blood sugar levels. In people who have had diabetes for years, early symptoms may be absent, and the initial sign of hypoglycemia could be altered awareness or coma. Diagnosis of hypoglycemia is confirmed through blood sugar measurements. In most situations, affected individuals recognize the early symptoms of hypoglycemia and measure their blood sugar using a test strip. If a person loses consciousness, health workers will follow a protocol which includes measuring blood sugar levels. It is recommended that individuals prone to hypoglycemia wear identification cards or bracelets that indicate their condition. Treatment for hypoglycemia involves sugar intake. If the affected individuals recognize the early symptoms, consuming a sugar-rich beverage such as fruit juices or Coca-Cola is most effective way to raise blood sugar levels. Chocolate is not ideal as its high fat content can delay sugar absorption. If they become confused or comatose, they should be turned onto their side to maintain a clear airway, and emergency services should be contacted. There are specialized sugar preparations for intravenous administration that can be used to correct blood sugar levels in cases of hypoglycemia that result in loss of consciousness and make oral sugar intake impossible. If intravenous access is not possible, glucagon, a hormone that counteracts the effects of insulin, can be administered. Glucagon is a hormone normally produced by the pancreas that raises blood sugar by stimulating the liver to release stored glucose. The prognosis for hypoglycemia is generally positive if the condition does not persist for too long. When individuals recognize the symptoms of low blood sugar and consume a sugar-rich drink, symptoms usually resolve within a few minutes. In cases involving altered awareness or convulsions, intravenous sugar preparation or glucagon typically resolve the hypoglycemic episode within minutes. Preventing recurrent hypoglycemia requires identifying its underlying cause and addressing it appropriately. This may include modifying eating habits and food planning with the help of a professional, typically a dietitian. If medications are contributing to hypoglycemia, it may be necessary to adjust the dosage, discontinue them, or introduce new medications. In case where a pancreatic tumor is the cause, surgical treatment is often the best option if feasible. Hypoglycemia is more than just a drop in blood sugar. It is a medical emergency that can develop within minutes. Recognizing the early warning signs and taking quick action can make the difference between a complete recovery and medical crisis. Whether you have diabetes or not, understanding hypoglycemia can save your life or someone else's. Always carry a source of fast-acting sugar, be aware of your body's signals, and never ignore symptoms that may seem minor. When the brains run out of fuel, there is no time to waste. And keep in mind that recurrent hypoglycemia can greatly affect quality of life and may lead to depression and anxiety. So, prevention is of paramount importance. Thanks for watching. If you found this video helpful, consider subscribing for more educational content. Have a great day.